Hello, my name is Sarah New and I am a PN student in the Dakota Nursing Program, and today I'm going to be demonstrating how to do a head-to-toe assessment for a pediatric patient. My patient today is my daughter Chloe, and she is 7 years old, so we're going to be doing a head-to-toe assessment based on her age group. So this is just my Wong Baker faces, just so you know, that's all that is. So we'll just set that aside. Okay, so I'm going to go into the room now. I would knock, 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 knock. Hello, my name is Sarah, and I'm going to be your nurse today. You must be Grandma.
I am.
So I'm doing hand hygiene, providing privacy. Can you go ahead and give me Chloe's full name and date of birth, please?
Chloe Bushnell, and her birth date is May 31st, 2012.
Okay, thank you. Hi, Chloe. How are you doing today?
Good.
You doing good? Okay. Are you feeling a little bit better? I heard you had the flu. Feeling a little better? Okay. So basically, I just need to do a quick little health history. And while I'm doing that, I am checking her overall appearance and respirations, just checking for like any signs of dyspnea, any cyanosis, any dark circles under the eyes, just her overall appearance. So, does Chloe take any medications regularly?
No.
Okay. Has she had any surgeries, any major health problems?
Nope.
Nothing like that?
Nothing.
All right. So, Chloe, are you in any pain right now?
Just ow. My tummy just started hurting.
Your tummy's hurting now. Well, where's it hurting the most?
Right here.
Right in there. Okay. And remember those faces we talked about earlier?
Mm-hmm.
Can you show me on this scale right here, kind of where you're at on your pain? 0 being no pain, 10 being like the worst pain you've ever felt.
Mine kind of used to feel like the 8, but now mine feels like
You're at like a 9. Oh, that's terrible. I'm so sorry to hear that. Is there anything that makes it better or worse?
only like with the medicine a little, but it doesn't make it really good.
Okay, so it doesn't take it away completely, but it brings it down a little bit. Okay, so sorry to hear that. We'll see what's going on with you today. So I have my objective signs of pain. I have her subjective signs of pain, so I can see that she is in a little pain because she's kind of wincing, and I also have noticed the petechia around the eyes from probably the vomiting, from the stomach flu that she's getting over. So we would go ahead and get vital signs, and I would get her blood pressure and her oral digital temperature, and just because that's what the doctor ordered, and I would go ahead, document all those things. And normally you would save those more invasive things towards the end, but since Chloe is consolable and it's not going to be too invasive for her, then we would just go ahead and do it. So we have her vital signs. I have her measurements. Earlier when she was going to get her height and weight, I was able to assess her gait, and everything seemed normal there. All right, so we have her vitals, we have health history. So I need to go ahead and check your head. Normally I would not sit on the bed, I would be able to raise it. For just the video, I'm gonna sit right here. So I'm gonna look at your eyes. Can you just look straight at me? Thank you. Oh, your eyes are so beautiful. So just checking for symmetry, any discharge. If this was a neural consult, I would want to check Perla, and also I would assess her extremities for like her motor abilities and compare that to her pupillary reaction and everything. So, all right, so we got that. Let's see. Face. Can I go ahead and see in your mouth, please, ma'am? Just open up and say, ah. We don't need to go poking around in there. All right, and then I'll check her ears. And since she is over 3, I would want to pull the pinna. That would go up and slightly back just to straighten out the acoustic meatus so we could get a clear vision of her tympanic membrane. All right, so you did great, thank you. So I'm going to go ahead and listen to your heart now. Have you ever got to hear your heart before?
Yeah.
Yeah, it's pretty cool, isn't it? All right, so we just want to listen for any signs of murmurs or extra heart sounds. It's not too uncommon in children to have a slight murmur, but even though it's kind of typical, you still want to report it if you do hear it. All right, so heart sounds good. Now at this time, I'm going to go ahead and get her heart rate using her apical pulse. And I'm going to compare it to her radial pulse just for checking any pulse deficits. And you would want to listen for a full minute, but for the case of the video, we're just going to listen for a few. So everything's good there. If her heart rate was under 60 or over 160, then we would want to report that and investigate further. So, all right, so listen to your heart. I'm going to have you sit up and let's put your feet on the side of the bed. All right, so I'm going to do a quick chest assessment. Go ahead and come forward for me. Thank you. I just want to make sure she doesn't have a barrel chest. And we already assessed for like respirations and any difficulty breathing earlier, so we're good on that. The lateral view is half the size of the front view, and that is completely normal. All right, so I am going to listen to your lungs now. So every time you feel this piece press against your skin, just take a deep breath, okay? Thank you. Perfect. Okay. We're just crossing over from side to side because you want to compare each side to the other, as well as you want to compare the upper and the lower. Good job. So I'm going to come over here and I'm going to listen to the back now. Breathe in. And again, we would just stair step down the same way, listening and comparing each side. Good job. Thank you so much. All right, now I want to take a look at your belly. So go ahead and lay back. Sit nice and straight for me. Perfect. All right, so I'm just going to listen to your tummy. So you just want to make sure it's nice and flat. It's not distended. It's not sunken in. So you don't want to palpate first. You want to listen first. You want to listen for any kinds of bowel sounds. Is your tummy going to growl at me? Yeah. Ooh, I heard it growling a little bit. All right, so bowel sounds are present in all four quadrants. That is good, and I'm going to just palpate lightly. Her stomach is not distended. It's nice and it's not rigid. It's nice and fluffy. I'm sorry. All right, so now I need to go ahead and check her extremities. So I'm going to look at your legs, Miss Thang. All right, so you just want to check their skin, just to make sure it's nice and pink. It's it's non-blanching, or it's blanching, sorry. It's nice and warm, it's dry, no signs of bruising or past trauma. We would check all extremities for that. Also checking feet for any signs of clubbing, because that could indicate chronic hypoxia. And we're going to check her capillary refill, which is less than 3. Pedal pulses are strong and equal bilaterally. And we want to check your hands. Can I see your hands, ma'am? Again, just checking cap refill, any signs of clubbing. All right, we're also checking for any bruises in multiple stages, because that could be a sign of child abuse. I look for that, make sure no one's beating on you. I probably shouldn't have said that. All right, good job. All right, so let's go ahead and sit you up. Oh, you did so good. Thank you so much. All right, so also, since Chloe is 7 years old, we would not be checking her bottom during a diaper change, so that would happen later on during the bath. And also, I just want to remind Grandma that if she needs to use the bathroom at all, just make sure you don't flush it, because we want to go ahead and get a good measurement of all of her bowel movements. Has she had any problems in the past with bowel movements, any constipation?
No.
Any kind of bedwetting, anything like that?
No.
Okay, so that's good. Okay, so I think we got everything we need. We'll go ahead and make sure that the bed is in its lowest position, side rails are up, the room is safe for me to leave, there's no cords in her way. There's the call light there. If you need me, just go ahead and ring that. And that should be it. So before I leave the room, again, just make sure that you don't need anything. I would perform hand hygiene and document everything that I assessed. And that is it. Thank you.